Loratadine is an antihistamine that helps with seasonal allergy symptoms like watery and itchy eyes, runny nose, and sneezing. Pseudoephedrine is a decongestant that can help with a stuffy nose, sinus drainage, and breathing. It's important to note that this medication is not suitable for children under 12 due to the high pseudoephedrine content. The recommended dosage for adults is 1 tablet once a day, and it's best to take it in the morning to help with allergy symptoms throughout the day. When taking Claritin-D 24-hour, you should take it by mouth once daily with a full glass of water. It's important to swallow the tablets whole and not crush or chew them, as this can release all of the drug at once, increasing the risk of side effects. Make sure to follow the dosage instructions given by your doctor and do not increase your dose or take it more often than directed. It's also important to note that you should not take this medication for several days before allergy testing, as it can affect the test results. If you have any concerns or questions, consult your doctor or pharmacist for more information. Some common side effects of Claritin-D 24-hour may include dry mouth, mild stomach upset, trouble sleeping, dizziness, headache, nervousness, loss of appetite, or thirst. If any of these effects persist or worsen, it's important to talk to your doctor or pharmacist. However, most people using this medication do not experience serious side effects. If you do experience any serious side effects, such as fast or irregular heartbeat, uncontrolled shaking or tremor, mental or mood changes, or difficulty urinating, it's important to contact your doctor right away. In rare cases, a very serious allergic reaction may occur. Seek immediate medical help if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. The recommended dosage for Claritin-D 24-hour is 1 tablet once daily, and it's best to take it at the same time each day. It's important to follow your doctor's instructions and not exceed the recommended dosage. If you have any concerns or questions about the side effects or usage of Claritin-D 24-hour, it's important to discuss them with your doctor. Before taking this medication, make sure to inform your doctor or pharmacist if you have any allergies to Loratadine, Loratadine, or any other allergies. Also, let them know if you've experienced serious side effects from similar medications in the past. This product may contain inactive ingredients that could cause allergic reactions, so it's important to talk to your pharmacist for more details. Before using Claritin-D 24-hour, it's essential to share your medical history with your doctor or pharmacist, especially if you have kidney disease, liver disease, problems with urination, high blood pressure, diabetes, heart problems, thyroid problems, or glaucoma. This medication may cause dizziness, and alcohol or marijuana can intensify this effect. It's important to avoid driving, operating machinery, or doing anything that requires alertness until you can do it safely. Limiting alcoholic beverages and talking to your doctor if you are using marijuana is also recommended. Older adults may be more sensitive to the side effects of this drug, especially experiencing fast or irregular heartbeat, dizziness, urination problems, trouble sleeping, or confusion. This increased sensitivity could also increase the risk of falling. If you are pregnant, this medication should only be used when clearly needed. It's crucial to discuss the risks and benefits with your doctor. Additionally, this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking Claritin-D 24-hour. Always keep a list of all the medications and products you use and share it with your doctor and pharmacist. Avoid taking MAO inhibitors while using this medication, as it can cause a serious and possibly fatal interaction. Also, be cautious of other medications, such as cough and cold products, that may contain similar ingredients. Additionally, do not use medications containing Loratadine while using Claritin-D 24-hour. It's also important to note that this medication may interfere with certain lab tests, so make sure to inform lab personnel and your doctors if you are taking this drug. As always, consult with your doctor for the best time to take this medication and the appropriate dosage for your specific needs. If someone has taken too much Claritin-D 24-hour and is experiencing severe symptoms like fainting or difficulty breathing, it's important to call for emergency help. You can call 911 or your local poison control center. In the US, the number for poison control is 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include irregular or unusually slow or fast heartbeat, unusual nervousness or excitement, and seizures. It's crucial to seek medical attention if you or someone else has taken too much of this medication. It's important that you do not share this medication with others. Sharing medications can be dangerous, as it may not be suitable for their specific health needs and could lead to potential harm. Always consult with a healthcare professional before taking any medication. If you forget to take a dose of Claritin-D 24-hour, take it as soon as you remember. If it's close to the time for your next dose, then just skip the missed dose and take your next one at the usual time. Don't take a double dose to make up for the missed one. It's important to store Claritin-D 24-hour at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.